Hakajing persang ban Kyntiew ban penne pensa ikikam ai Dawai Kynbat bat kirukom Sumartan Rai ka Sorkar Meghalaya lingba ka Bio Resources Development Center BRDC mentagasngi kilale Burom ya khandangut kinong ai Dawai Kynbat hapo ka Voluntary Certification Scheme for Traditional Community Healthcare Providers lanika VCST CHP hakajing rakhi kabalalong ha Secretariat Wellness Center. U Commissioner but Secretary Jong Katanat Kakot Kakya u Dr. Joram Beda IES ulayaro ikinong ai Dawai Kynbat nakabenta kajing no asanyang kajongki kabanadu tanrai bat ulaban juru halor kajing treshitom kajong ka Sorkar ban penyes no alang ya kajing nang jing tip tanrai bat karukom sumar sukher jong kani kajup ka pementa kiblai don lang ha kani kasngi hikinto bi Professor Darlandu Kathing bat kiwe ki kendam kilendan ka program kulakut ha kajing kuntu da kawe kasur bandon kajing atrelang ha pedeng kirukom sumar tanrai bat kirukom sumar kajup menta ban pentikna bakadon karukom sumar sukher ka babiang hapo kajilla.
As a part of my public experience, I realized that knowledge is immense. It goes beyond books. So that's the reason why I always insist that there is a treasure trove of knowledge amongst the traditional healers, which needs to be studied, understood, and we need to implement it and make it part of the mainstream. But how to make it as a part of the mainstream? There is a thin red line. And that is where initiatives such as this, the quality assurances, the quality certification comes very, very handy. Number two, why traditional healer? The engagement of traditional healer for the mainstream health is also very important, is because you have a greater outreach. And that outreach matters a lot so far as implementation of any health schemes or initiatives are concerned. So my humble request to all the traditional healers is, please work in tandem with the health department. Now with the BRDC's initiative of certification, you become officially certified for a cause. So that makes it even more relevant for you to work in tandem with us. So we have in our field the medical and health officers, the MLHPs, the ASHAs. So you should also be part of that effort to ensure that best practices in healthcare are practiced in the remote rural areas. Talking about the traditional healing, Gunanka, I can give you my own personal experience. My younger brother had a major accident, a traffic accident, and his spine, the lumbar area was totally, it was totally injured, and the orthopedician said that it may be very difficult for him to recover for a long time. That was when they approached traditional healer. The traditional healing practices in Northeast is particularly very effective in burn setting. And this is known in my home state of Arunachal, and I got to know that it's even better here in Meghalaya. So that is one area that we all need to explore. And with the intervention of the traditional healer, he said in 2 days he will stand up and walk. And in contrary to the orthopedician's predictions, he actually stood up and walked. So that was kind of a miracle for me as a doctor. And this needs more of a scientific study, more of an modern administrative approach to understand this. And again, this quality certification is a part of that effort.